Welcome to Lejeunecast, the podcast for Lejeune family medical practice. To support these podcasts, you can donate to the Lejeunecast Patreon page, the link to which can be found in the description. To book for your next appointment online, renew your prescription, and much more, head to lejeunmedical.com.au. Your host for the podcast, Dr. Michael T. Smith, is a general practitioner with an interest in child health, palliative care, and skin cancer medicine.
Do you think this process has made you stronger as an individual?
I've always wanted to remain positive, but I can't do anything with the late diagnosis. I can't change that. I can't go back. But what I need to do is face what I've got to handle and do the best with that. I always assured Tim wherever I went, if we did sell the house and move somewhere else, that he would be with me. No matter what the situation was, I would care for him as long as I could.
Happy Mother's Day to all the mothers out there. We hope you're having a great time with your families. Today we're talking to my mother as part of this podcast. My mum's been through quite a difficult journey in the last couple of years, and I thought just to catch up with her. Mum, welcome to Lejeunecast.
Thank you, Michael.
In 2016, my mum was diagnosed with bowel cancer. There's been a few ups and downs along that journey, 3 years down the track, and we just thought talk about that. Right, so what was it that prompted you to go to the GP in the first place, and did you have any other symptoms that worried you?
I did get several of the bowel screening tests but never used them. I wasn't sure what to do, and in the meantime I'd already been tested and found to be needing some extra follow-up. My first blood test at a new medical centre, the doctor suggested I have a full blood count, and that revealed borderline anemia. She then said, I said, what are we looking at? And she said a slow leak.
So I guess the message there is really important to follow up if you've got those testing kits at home to go ahead and do the stool test, because an early stage bowel cancer is actually very manageable.
So then she said, okay, I'll do stool testing as well, which she did.
After you had the gastroenterologist input, what was the process then?
Then I was scheduled for a colonoscopy at Auburn Hospital. That was carried out, and the message came afterwards for myself and my husband to wait until the doctor was able to give us the diagnosis.
And what did the gastroenterologist tell you?
He said we did find a growth. During that interview, my husband asked, well, what are we looking at here? And the doc said very bluntly, bowel cancer. I was given a referral to a surgeon, and then I met him, and within 10 days of that meeting, I was being operated on.
Yeah, gee, that's super quick. You had a very skilled surgeon who was actually able to do most of your surgery through camera, through a laparoscopic approach, just a small vertical incision to get the rest of the cancer out. How was your recovery after the operation?
Well, for one thing, I didn't have pain when I came to. The sutures healed very quickly, and then I went on to a course of 2 anti-cancer drugs afterwards.
Some of the patients that might worry about having that portion of their bowel removed, in your case you had a hemicolectomy, so half your large intestine removed. What were the concerns around that after the recovery? What were you told going into that?
I was very pleased to hear that it was a right hemicolectomy, and that made it easier. I didn't need a stoma bag. That was a joy to go through, that I didn't really sort of feel any bloating or anything like that.
Yes, that's often a concern of patients going into surgery, is the fact that they might have a bag when they wake up. So, of course, they're consented for the possibility of that. But in your case, you were fortunate. You were able to get the bowel connected back together again in the same operation. So you went through Westmead Cancer Centre, and you had care from that team for about a year. Is that right?
First of all, I had infusions at Westmead Hospital. They were very debilitating, not because I was getting side effects, but because I had very little use of my feet and I had bad balance, and I always needed a chauffeur to drive me home that day. That was the infusions, and then at home I had a fortnight of tablets, which were apparently normally paired together, the infusion plus the particular tablet. And that went on for 6 months.
6 months, I see. So it's not the typical picture of what people might conceive chemotherapy to be. They think about, their hair falling out. They think about being nauseated for days. They think about being, isolated from everyone. But it sounds like your experience was quite different.
I was told from the beginning I wouldn't have any hair falling out because this particular medication did not include that side effect. I was given, every time I had the infusion, 3 days script for antiemetics to prevent me from losing the infusion.
How was it to be on the receiving end of the care from the nurses and all the other team?
Those girls are worth their weight in gold. It may not be easy for some of them because perhaps they do lose some of their patients, and it's not always easy for them to carry on and be positive about other people's care. They were always there should I need to ask the questions.
From that, you were staged as having stage 3 bowel cancer, so there was no cancer in any other organs except the bowel and the lymph nodes, and surgery was able to render you cancer-free, as far as we could tell with the resolution of our machines. But then something came up on a scan. How long after the chemotherapy did that surface?
I finished my first lot of cancer in October.
2016.
In 2016. And then the following year, in February, I had my first PET scan. And I had previously also had a CT scan. So they followed it up with a PET scan to get a better idea of its position, I think. I went for a second opinion of one oncologist, and he said it was noticed in the first place when the PET scan was done for the first operation. And he had suggested a laparotomy with this second growth removal, because once it's out, it's out. I then got a phone call from the surgeon. And he said, you can either see me today and be operated on Friday. That was Tuesday. I started with a laparotomy, and the surgeon did say that if he finds a cancer site, which can be seen long before the scan, that he would stop the operation. Later on, I found out because of the position, he called in an extra surgeon.
Yes, I remember that discussion with the surgeon. He said it was like trying to find a marble in an area of sand on the beach. You just draw a square on the sand, you say, okay, there's a marble in there, go find it. Unfortunately, with the bowel, it can be very difficult, even though these things do come up on PET scans. So between August 2018 and after that time, you again rendered cancer-free, as far as we could tell, through the surgical efforts. Then in February this year you had a bit of bad news, is that right?
Yes. I was told, I did get a call from the surgeon. I was still on 6 months course of the same tablets. I got the scan, and it was a CT scan, something like 9 months since the last one in May of 2018. And it was discovered there were 3 shadows on my liver. They were grey at the time when I saw them. At the time, it was implied that the one end of the liver was cut out. There'd still be others in the liver. I have since changed my oncologist, and he has said that the left side is okay and speaks of surgery in the future. Yeah,
so I think my observation of you having stage 4 now bowel cancer is that you've always been positive and practical. You've always been orientated in a direction towards doing something about this. I think others perhaps would feel quite overwhelmed or devastated, to use that word, by this diagnosis. How has your thinking developed over the 3 years of this journey?
I've always wanted to remain positive, but I can't do anything with the late diagnosis. I can't change that. I can't go back. But what I need to do is face what I've got to handle and do the best with that. And the knowledge that I gain along the way and the advice that I get, and carry on from there.
As they say, every cloud has a silver lining, and in your particular case, you still had an adult son living with you at home who needed some extra care.
Yeah, I had a son who was diagnosed with borderline autism. He was seen an employment consultant, but there didn't seem to be any perhaps anxiety on his part to get a job. And then towards the end, before he successfully got his DSP and his NDIS to get accommodation so that he could be looked after, my situation was paired with his condition, that if my condition turned suddenly, where would he go as far as who would care for him in the future? His developmental disability doctor and his GP and the support coordinator at McCall looked after him and all got on the one page and strive for the same achievement, that is accommodation for Tim. And now he's been there for 14 months.
Accommodation, but also case management so that Tim gets the care he needs. And not easy having a cancer diagnosis, but oftentimes it's that impetus we need to mobilise the resources and to leverage the supports we can to look out for those people who are going to be affected by this.
Yeah. I always assured Tim wherever I went, if we did sell the house and move somewhere else, that he would be with me no matter what the situation was. I would care for him as long as I could.
Any reflections on Mother's Day today as to how your particular journey relate to the reflections on being a mum? Some of our listeners wouldn't know, but my mum, I'm the youngest of 6 kids, and my mum's brought us up in various situations. Oh, by the way, yesterday it was my dad and mum celebrated 51 years of marriage. Yeah, just the question is, I suppose, any reflections on this cancer journey, but Mother's Day on today in particular, and mothers in general, I suppose.
Cancer is probably something that comes to a lot of us, and you always will be a mum, and you will always have to care and think about your children, even though they may be out of the house. They're still connected to you, and anything that they might be able to perhaps support you with is always welcome, and in a way perhaps expected, especially when they're so tall and capable.
Well, yeah, I mean, my own, just to talk about something, 2007, I was working in Macquarie University, in one of the administrative places there in the university, and I found out that I'd gotten into medical school, and I'd only applied for one medical school, Sydney University. I had just scraped in, and as a result, I wasn't going to have a Commonwealth supported places, and as a result, university was going to be very expensive. And I remember I called Dad and I said, "Dad, I got into university. Great, fantastic. You're going to go to medical school. Wonderful. There's a problem. It's one of those fee-paying places, Dad." And the line went silent. And Dad just said, "Oh, Mick, we just can't afford it, And then I heard your voice in the background. Mum said, I remember what you said, "We can afford it." I heard Mum come out of the blue and say that. So it was because of your insistence, Mum, that many years down the track, I am a doctor. So on Mother's Day, I say thank you for that belief that you had in me, and thank you also for the sacrifices you made in that regard. And, sometimes the things have a funny way of coming round. You told me that you had this anemia, so we made a few calls, got you into a gastroenterologist extremely quickly in the public system, and as you said, 10 days later you were on the operating table, so you certainly have had very good care. So that was, I guess, in no small way as a result of looking out for your children, and for that I thank you. Okay, Mum, happy Mother's Day once again, and thank you very much for speaking to Lejeunecast.
Thank you, Michael.